First of all, thanks to you and the staff. I mean, this is an extraordinary situation, and you're pulling this together and getting everybody up to speed on use of Zoom and so forth. I think it's a big step forward. Um, I'm wondering if we have any information on the sources of um, contamination, if you will, for the people that have contracted the coronavirus here in town.
It's kind of an interesting situation. In some of the early cases that we got, one of them particularly was in an assisted living facility. And you can imagine, just prior to the orders that were given to lock down those kinds of facilities and keep out visitors, the type of daily passage that was going on in those facilities with visitors, family members, and kitchens and lunch areas, and just the general socializing that's been done. And then, so we had a case there at one of the facilities, and Bruce and his team got on it. The management took it seriously. They locked the place down, cleaned it up. And we haven't had, to my knowledge, a second case there. And actually our facilities of congregate care, if you will, and assisted living have been faring pretty well. We did have a couple of cases of retail environments have positive employees. And from there, you just don't know. I mean, they're drive-through windows, they're seeing so many people that it's nearly impossible. And we do know one of our own police officers tested positive, and he had recently been on National Guard duty. So we get a little bit of detail sometimes, but in the nature in which people travel, even now with all that's out there, there's still people. I see at Town Hall, crowds of people walking down the sidewalk and kids and kind of carrying on like there's nothing going on. So the health department, and Bruce should be on the call, he might be able to give you more specific details, but that is clearly like, where have you been within the last few days becomes critically important. And the metric we use for that, so that you know, is that if you've had a contact with somebody for more than 15 minutes within 6 feet, that's considered a potential contact that we want to find out who those people are and communicate with them. So like in the police department situation, every call that goes out and it's more than 10 minutes on a contact, they're logging that in, because if one of them gets a quarantine, and we've had a couple, or gets infected, the amount of people that they come in contact every day is pretty significant. So we're still working with the state, interestingly enough, on the protocols for police and fire to safely engage the public in this new environment, knowing it's highly contagious. And there are stories across the Commonwealth of police departments with many dozens of officers, sideline firefighters. I know one fire department on a 90-member unit, they've got almost a dozen firefighters on quarantine. So what we've been working on with the state is these contingencies that if you get decimated in that workforce, who's going to backfill? So we have like a rollover agreement amongst the towns on Cape Cod, but ultimately what you see, like in Springfield, they called in the National Guard, and they'll have 75 guardsmen patrol the streets. But that's the problem with what we've got between the positives and the presumptives. It takes down a lot of human beings potentially. And so we're doing the best we can to track down the sources and where they might come. And you've heard some cases like Biogen was clearly an incubator for the problem. I'm familiar with a wedding ceremony at a community with 200 members that have now been responsible potentially for a big outbreak in that community. So there were a lot of these activities going on just before the lockdown orders that were just normal socializing. That now we're starting to see that with ramped up test results.
Mike, can I just say, I just want to thank Dan. I think his memo that he sent us this week was very, very helpful and detailed. And there's really a lot going on. I don't think the general public knows all the stuff that's going on behind the scenes and everything our staff is doing. But just to send out a special kudos to those that are making those connections between our most vulnerable at the senior center. I'm very, very grateful. And it brings me in the midst of all this some peace knowing that that's happening. So I'm very grateful for your work towards that, Dan. Thank you.
And I can tell you, DY schools, when we were short on supplies or we needed bullhorns, they were right up to the plate. They helped us with the lunch program. And now, just to let you know, a lot of kids had instruments stuck in school. So they worked with Bruce Murphy to come up with a protocol on how to spring the instruments out of school so the parents can pick them up. I mean, there's a lot to like just having this contact because of the nature of the virus staying viable for a number of days, which includes, Jane Kane and Diane Kane over at the senior center, listening to their public about the isolation they're feeling, and Jane coming back to Bruce and I about, is there a way that we can open up some, what I'd call drop delivery library services in a safe manner so people can order their library materials. And we've worked that out. So one of the things we're always mindful of is that when you can do something to bring a vital service back to the public and safeguard both the public and the employees, then we should go about doing that. We've been able to do that. And I anticipate, because now this is our new normal state for a while, we'll be able to bring on a few more services that have been missing. But they all have to be vetted out and carefully reviewed, and procedures have to be developed and people have to be trained before you do it, because this is really a life and death situation. I mean, there are days where you just can't even believe that we're in this situation that we're in,
Okay, anything further on the update of town services and efforts?
No,
regarding-
that's pretty good. That memo details it. What I've asked the departments to do is every 2 week on about a 10-day cycle to generate new information going forward so that you can see how they're operating in this environment. And as I get that information, I'll generate a memo to you and we'll have regular updates.
Again, I think also that's very helpful, and I think that's a good practice going forward to stay with that format. Norm, anything?
Nothing. No, thank you.
Mark?
Statements that Tracy made.
Eric? Okay, I guess we'll move on to the next item then, which is beach closures.
So this is a continuation of last meeting's discussion. Bruce Murphy and Hillary Bosky should be on the phone with Jay Tallerman, the town council. The Board of Health convened a meeting yesterday, and from that meeting, they generated an official order for the town. And I received a legal brief from, or an opinion from Jay as the authority under which they have done that. So I would also like to let you know that within the last couple hours, Governor Baker ordered the closure of DCR beach parking lots. So, I mean, this is something that I know it was a passionate topic and a hot topic, but it seems that as we get deeper into this thing, that precautionary measure is becoming more popular amongst coastal communities. So I've asked them to be able to respond to any questions that you might have.
Anyone would like to speak, please use the raise hand function on your device.
I'm not sure it's always showing.
No, I'm not. Do you have anything, Norm?
Yeah, I guess I'd like to ask Bruce Murphy and our representatives of the Board of Health on this call.
Yeah, Bruce and Hillard should be in there. I'm not sure if any other members called in.
Okay. What evidence they might have with regard to issues at any of the town recreational areas.
The moderator would like anyone to raise their hand so he can recognize them. What was that?
The participant identified as iPad has been unmuted if you'd like to speak.
Hi, Mr. Chairman, Tom Sullivan. Can you hear me?
Yes,
I'd like to know more about what the Board of Health's order is on the beaches. Over the last couple of weeks, I've been going to the beaches. I have not seen what they're saying. I go down to Smugglers and I've seen people in cars and their cars are separated. They don't get out of the cars. On the warm day we had, there were families down there. The families stayed together away from other families. So I like to know what more are they saying, because I'm not seeing what the Board of Health is talking about.
So I guess your question is, what's the rationale for the beaches? What specific evidence do they have that the keeping people off the beaches is a deterrent to the spread of the coronavirus? Well, we'll start with Bruce Murphy. Can you identify yourself? Raise your hand, I guess, to be recognized by the moderator. If he's on the phone, press *9.
This is Hillard Bosky. Am I being heard at this point?
Yes.
Oh, that's great. I can certainly answer the question. I'm not sure Bruce is on at this moment. Maybe
Okay.
he's muted. I'm not sure.
Okay. Well, if
Yeah,
he's around,
maybe-
he'll probably turn up in time. But you're
I'm sure he
you're
will.
clearly recognizable now by graphically and also with audio.
That's great. Yes, our main concern essentially was closing areas of gathering where we've seen people, recreational areas, and certainly parking lots of the beaches, on the beaches, the playgrounds, basketball courts. And that's what was observed by the Board of Health, as well as the Department of Health, making trips down, and that's what we saw. And it's essentially people not maintaining 6-foot distance. They're not really performing the social distancing that's been described by the Center of Disease Control. You know, as for the beaches, it's unfortunate. That restriction does prevent a small group of individuals like myself who stay at home, do not have visitors, don't go to other people's homes, maintain the social distancing, and unfortunately not able to walk on the beach because of the restrictions. However, on a personal level, I don't think walking around the quiet neighborhood streets where I live is a major compromise, considering the present pandemic. And that's what we're attempting to do, is really keeping people at home. The emergency is really hard to fathom, just how contagious this virus is. There is no cure for it. All we're able to provide is supportive care for people. This is not a type of infection where you take an antibiotic and it goes away. I'm sure you see that on TV. Last night, the final statistic I saw was over 900 Americans died from COVID-19. And it's important to realize these people died despite being treated with ventilators that are still available. And without maintaining the social distancing and people staying home, the president's senior advisor, Dr. Fauci, which I'm sure you've all seen on TV, gave a projection of 1.2 million Americans will die if they're not following the stay-at-home orders. And if they do, the projections are, I think, about 100,000 to 240,000 of us in this country are going to die from coronavirus. So I think the Board of Health and the Department of Health has moved really very quickly and efficiently to protect the public. That's our responsibility. We're trying to save lives here. I'm not sure if that answered your question or not.
question was asked by Mr. Sullivan. I think when we last spoke, and by the way, Bruce is on the line now. Can you hear us, Bruce?
Yes, I can.
Okay. When I think you last spoke to us, you indicated that you had seen some people down at Gray's Beach gathered together, and that's what prompted the idea of a beach closure. I don't think you indicated at that time that you ever had visited or examined the Southside beaches. Is that correct? My question is directed to Bruce, and then if Dr. Bosky wants to respond as well.
Yes,
I don't think you actually went out and conducted any kind of survey of the beaches before you made the order that the beaches were off limits, did you?
No, I did not. I did hear from people calling the office, calling me saying there was some gathering at the beaches. I did see gathering at the parks, especially Homer Park where the basketball courts were, and people calling the office saying there's gatherings in town. And these were public, popular areas, and decisions were needed to be made on information that was received.
Well,
and I know Hillard, the chairman, had in fact gone down to Gray's Beach, and he can give you some of that explanation on that.
yeah, Gray's Beach is a little different because of that boardwalk there. I mean, obviously that's somewhat problematic to keep 4 feet apart when people are coming in different directions on there. I can certainly understand that. But I have visited the Southside beaches the last 2 weekends. And very honestly, I don't see public gatherings. I don't see people not observing social distances. Obviously, if there's a husband and wife or a couple walking together, they walk together. They don't stay 4 feet apart. But there's a lot of singles that, you know, people are very concerned about catching this thing as well as transmitting it. And seems to me they go out of their way to stay away from other people a lot further than 4 feet apart, more like 20 or 30 yards apart. The only people I've seen in the parking lots, especially at Smuggler's Beach, are people that park up by the river and stay in their car and just enjoy looking out the window at the river. I don't see groups of young kids. Now, I have seen people violate social distancing, and I'll tell you where. I've seen people walking on the street where there are so many people that they span the entire street. And I was in my car and I had to come to a complete stop until these people filtered down both sides of my automobile so I could pass. I've seen in my neighborhood high school kids playing basketball with their friends, which the governor has gone out of his way many, many times to tell people they shouldn't do. And if for a minute I thought that there was evidence of people gathering either on the beach or in the parking lots, or people violating social distancing, I would say no matter what that area is, shut it down. Obviously, anybody who's listened to the president and the governor and Dr. Fauci over and over and over again knows that these kind of violations put everybody at risk and start that chain reaction of infection. But honestly, I've spent, not last weekend, but the weekend before, probably about 2.5 hours on the Southside beaches. I don't see that. I don't see that happening. Frankly, I don't see that many people on the beach. I see more people in their cars looking out at the river than I do at the beach. I also see people parking their cars and walking down South Shore Drive, using it as just a starting place for a walk. So I'd have to respectfully disagree with anybody that says that's going on in Yarmouth. The other problem that I have is the other towns on the Cape, Dennis, a lot of Yarmouth people are going to Dennis and enjoying the beach and taking walks. It's not something that at the federal level or the state level seem to be a big concern. In fact, I've heard Governor Baker many times say to, in the course of his presentations, people, get out, and get out into fresh air, but make sure, you keep your distancing. Now, I don't know why Yarmouth is unique in the state of Massachusetts and maybe even, beyond. I don't see the danger there. If it's there, I'm missing it because, I went out and studied those areas. I did not go out this past Sunday. I was out Saturday, but I didn't go out Sunday because it was raining. And I assume nobody's going to be on the beach when it's raining, but I can't speak for Bass Hole. I only went up there once,
I'd like to
2
I'd like
weekends
to
ago. Norm probably knows that area better than I do, and Eric and people that live up on the north side. But when I went up there 2 weeks ago, I did see people on the boardwalk. I couldn't tell how many. I was a distance away, and I don't know if they were part of the same family or not. I couldn't tell you that, but others can probably comment on those areas.
I'd like to speak if I could on that.
Go ahead, Norm.
Yeah, I'm at the boardwalk almost every day, and I have seen very little in terms of groups of people. I've been out on the boardwalk myself, and have seen very few people. And there's no big group gatherings there that I can see. And I think that what's happening is we're driving people out of town to other beaches and creating issues in other towns. And I believe me, I understand the concern here and the worries. But on public highways, if we have a speeding problem, we have police enforcement. We don't have any enforcement with regard to this. We just are angering people and creating a situation where if they're angry enough, they'll just disregard it because there's no enforcement, or they're going out of town and going to facilities in other towns. I wanted to go down and fish in Long Pond. I'm an avid fisherman, and there's a sign, public not allowed. Well, I don't think that's legal because the pond is stocked by the state. And so I went over to Dennis and fished at Scargo, and then up to Cliff Pond, which is a state pond in Brewster. So I think other people are having the same experience that I'm having, either aggravated by what the town has done, and I guess I would add one other thing. It seems to me there's an intermediary step, and that is trying to get something in front of people that warns them about what they should be doing, the social distancing and so forth. And instead of having an 8.5 by 11 piece of paper that you hardly notice, why not have a big sign that talks about the things that should be done to avoid contamination? And I think there's more effective things to be done than just simply closing down our public facilities. I'm not talking about the town building. I think, I think that was a wise decision because of the fact that you're congregating there and having our staff constantly meet the public. I don't think that's a good idea at this stage. But I think driving people out of town by closing a lot of our facilities and that we all enjoy, I think is just too quick, too soon. I think we need some intermediary steps.
This is Hillard Bosky again. I think that's just the point I'm trying to make. If we're having people who are picking up and driving to another town, that says a lot, that people are not really following the order to stay at home. Which right now, it's 85% of the country is on the order to stay at home. That's how serious this is. You need to recognize if you're walking with a friend and the friend has seen other people, they may be asymptomatic for 4 days. They don't know that they're shedding the virus. The person has no symptoms whatsoever, and you can get the virus from that person. That's what's so scary about this. And right now, statistics show that if one person gets the infection, they transmit it to between 2.5 and 3 other people. Just think of that. Each person spreads it to 3 more people. That's how quickly this is spreading. And it's just people having trouble comprehending how dangerous this is, especially in our community. You know, the population here is elderly. There's a high level of poverty here. So we have a especially high degree of vulnerability for infection. Our first responders are in quarantine. We have a positive case already. And these are the people out front. The number of confirmed cases is growing. You have to remember where you live. On Cape Cod, we don't have large academic hospitals. We don't have scores of 30-year-old health providers there. That's not the kind of hospital we have. So we're trying to prevent people getting sick enough that they have to go to the hospital, okay? You know, when you talk about 240,000 people dying, I don't think the issue of going fishing is what needs to be discussed tonight. That's my opinion. I think it's a lot more serious than that. Compromise of not driving to another town to walk on a beach or even your own town. It just doesn't seem to make sense to me. There's science there. It shows that staying at home, maintaining your social distancing, significantly lowers the transmission rate of the virus, and that saves lives.
Why do you suppose then, though, Doctor, the governor, with all of his resources and all of the expertise of the scientists in Boston and the hospitals that are among the best in the world, why do you suppose he hasn't issued an order to close down all the public beaches?
I lost the last part of your sentence there, sir.
Okay, I don't know. Well,
The last 3 words, I didn't hear it.
Why do you suppose the governor, with all of those medical and scientific resources that he has in Boston, which is one of the medical capitals of the United States, why do you suppose he hasn't issued an order to shut down all of the beaches in the Commonwealth? If they are in actual danger of spreading the disease. I don't disagree with you about how lethal this disease is. Some of the statistics you cited are different than the ones I've heard about, you know, somebody being asymptomatic for 4 days. I think it's more accurate to say 2 days. And the rate of infection I've heard is about 2, not 2.5 to 3. But notwithstanding that, why do you know, the governor has shut down restaurants, he shut down religious services in churches and synagogues, which is pretty serious in terms of, you know, people's right to worship and their First Amendment rights, and all of those things have had to yield to public safety. Why do you suppose that he has not issued an order to shut down all of the public beaches, which he could do, if it's a serious threat, as you indicated is?
Well, I must say the Board of Health and the Health Department is not really following exactly in the order that Governor Baker has been conducting himself. Basically, what we've really been following is the Center of Disease Control. which is the most respected organization on the planet dealing with infectious diseases. And we've really been following their guidelines. So I think we've been ahead of the game here, and I'm proud of it. We've been working very efficiently, and hopefully we're making a difference. It's been very hard to educate the public what the situation is and what this emergency is all about. So I'd rather look back 4 years from now and thought, well, maybe I overshot and made too many restrictions, as opposed to wishing I had done more.
Are you saying that the Center for Disease Control has an official position that public beaches should be shut down?
No, they give very clear guidelines of what the recommendations are, such as stay at home and degree of transmission of viruses. And it's based upon that information is what we've acted upon. So we're trying to follow the scientists. This is what we've done.
I think your risk of going
That's what
far greater than it is going to the beach, to be honest with you.
Mr. Chairman,
Yes, Tracy.
I appreciate all this back and forth, but since our last meeting, not much has changed. I think there's clearly a divergence of opinion, which is completely fine and respectable, but I think it's time to move on. I mean, we went on the record last week of saying we disagreed with the decision, and it doesn't appear to me that there's any change of heart or change of opinion from the board. They met and they took a vote, and while we may disagree with it, it is what it is at this point.
Well, I can just say the Board of Health and the Department of Health certainly welcomes your involvement and support fighting this deadly pandemic, and we'll see if we can work together.
Well, just because we have a difference of opinion doesn't mean we're working together. We both have the same goal. Certainly, I think, I value your opinion and the entire board's opinion in trying to keep the public safe and healthy. And, our board just feels that you can do that with having the beach open. You disagree. It's just time to move on, in my opinion. We're going around in a circle. It's no disrespect to anybody on either side. It is what it is.
Well, we've spoken before you twice now. I'm just curious what the other members there, what their opinions are.
I think we expressed our opinion to you at our last meeting collectively. So I think all of us feel that, and I agree with Mike, perhaps the boardwalk is a separate issue because you can't, you can't have 6 feet of space on either side. But in terms of the beaches, I mean, people are really, we do have a acute public safety issue with COVID-19, but, we also have people with depression and other issues that sometimes walking on the beach is good for that. And, in my opinion, no matter what you say, you really can't legislate people what they do in terms of people just being smart. So let's just hope people are smart about it and they don't come 6 feet within each other, regardless of what any of our opinion is. The goal really should be to just stress that. And I think the difference is our board believes that it can be done with keeping that personal space and the social distancing, and you don't believe that that's the case. So it's just a divergence of opinion. And at this point in time, I feel like we're going around and around.
Unfortunately, I tend to agree. I wish the Board of Health and had come to our board in advance. I think there was an opportunity to do that and to arrive at a solution that would have been in everyone's interest and would reflect the needs of the entire community and would not penalize 99% of the people that are obeying good social guidelines. And I think it's unfortunate, it's like stopping everybody for speeding, or just stopping everybody on the road because one person is speeding. That doesn't work. That isn't what you do. You don't close down every public facility because one person or even several people are disobeying the laws or the rules. I think we could have done more working together on this than having the divergence of opinion and the perception that there's a lack of support.
I would agree with that. And in fact, there's provisions in Chapter 111, which is the public health law, that talk about dangerous diseases that exist in town being addressed by the Selectmen and the Board of Health together. And I'm a little bit surprised, really, that we have never been invited to participate in the process of talking about the things we've talked about at this meeting and the previous meeting. It seems that the board's taken a position that they prefer to act unilaterally. And I think that's really unfortunate. And I think there's people in the public that think that the Board of Selectmen are not standing up for them or representing their interests. And I think the reason for that is we've never had that opportunity to do that. Mark, do you have anything?
Yeah, the only concern that I have, can you hear me okay?
Yeah.
The only concern that I have is that at the very outset of this, town council laid out a set of recommendations for both boards to collaborate. And I'm just disappointed that those recommendations really weren't followed, because I think it could have avoided a lot of this. So that's my comment, and that's all I have to say. I mean, I appreciate obviously the hard work that the Board of Health does. I appreciate obviously the seriousness of this. It's a very, very difficult time right now, but I think that process that was laid out by town council's memo, I think would have, like I said, would have created a process with real clarity. I know other towns have followed similar processes. I just think we should have done the same. So that's my comment. Thank you, Mr. Chairman.
Thank you. Eric, do you have anything?
I agree with a lot of what's been said. I am a person who believes in a lot of personal accountability, and the Board of Health has essentially taken away people's ability to make that decision on their own. I think that people get it. I think the problem of having kids congregating, you're not going to get rid of that no matter what you do. You could close the entire town and kids are still going to congregate. But to take the ability away from adults who get the seriousness of the problem and not allow residents of a seaside community to walk on the beach when there really isn't any other outlet in a time like this, that's extremely unfortunate.
Mr. Chairman, there's a member of the public that wanted to speak if you want to recognize Mr. Sullivan.
Mike, you're muted.
Can you hear me?
I can hear you, yeah.
Okay.
Hold on. One question for the chairman of the Board of Health. How's it going to be enforced? Are you going to have the police running around, sitting on the beaches all day? I think they got more.
Absolutely. Absolutely not. The police have bigger things to take care of right now. So no, if they get a call that there are 35 people at one area, sure, it's time to call them in. Otherwise, no, none of us would want the police going down every 20 minutes to look at the beach. Not so ever.
Okay. And there'd be a danger too that they'd expose themselves to the risk of catching the virus, the more people they encountered. All right, anything else? Bruce, do you want to say anything?
No, that's fine. I defer to the chairman.
Okay, very good. All right, well, thank you for participating, Dr. Bosky and Bruce, and standing by, town council, appreciate it. I'm gonna move on from that item to the shellfish permit extension, which is our 7:15 item. Are we ready for that?
Yes, Mr. Chairman, there's a memo generated by Director Von Hohn requesting a extension period to the recreational shellfish permits to a date up until April 15th or 3 days after town hall reopens to the public if town hall remains closed beyond April 15th. Further, he goes on to state he doesn't recommend a change to the March 31st, 2021 expiration date.
I make a motion, we approve the extension.
Second.
Okay, let's have a roll call vote. Eric,
Aye.
Norm?
I have a question.
Yep.
How are we acting on something that has to do with the beaches? I'm confused at this point.
This is the permit that would allow them when they can get access. Some people wanted to get their permits. They're not that they can access now, but they wanted to just go through the process of getting the permits.
You seem to be cutting in and out.
The request was to extend the time in which you have to get your permit. I mean, so part of this request was, this was generated a few days before March 26th. At that time, we didn't know that there would be an extension beyond April 3rd to May 4th. So Carl put in appropriate language in there that allows the extension such that at such time town hall reopens, if it's after April 15th, then people have 3 more additional days to get their permits.
Yes, so that technically should say whichever's later,
Yes,
right?
right.
April 15th or 3 days after town hall reopens, whichever is later.
I would say now, based on what we know, because of the order from the other day, we could probably delete April 15th and just say 3 days after town hall reopens.
That would also be okay.
I'll move to amend my motion.
I'll amend my second.
Also, is town council still on the call?
I don't see him.
I was just curious to Norm's point, whether or not we have the ability to restrict people's rights to water for fishing purposes.
I can certainly ask for that.
Well, I know with respect to tidal waters, there are certain rights that people have between the low water mark and the high water mark, but that's limited to, David knows this better than I do, but it's fishing, fowling, and navigation, I think the statute says.
Fishing falls under that.
Yeah.
Yeah, what I'm specifically referring to is freshwater. And yeah, the state has certain regulations with regard to accessibility of bodies of water of a certain size. And they also agree only to stock fish in waters that do have that public accessibility. And in this case, Long Pond was stocked a couple of times during March. And it's been stocked for years because it historically has been accessible to the public.
Well, I know Carl's on the phone. Perhaps he could tell us.
Yeah. Yes, I can shed some light on the 2 questions I heard come up. The first thing pertaining to the shell fishing, currently no areas are open for shell fishing at beaches. Bass Hole may open in May. We can address that at that time. As far as fin fishing, the public in some areas have the right to gain access primarily through Great Ponds. There are other access points on Long Pond and most of our other ponds that aren't associated with per se beaches. I imagine Selectman Holcomb was going down to Indian Memorial for access there. But in Great Ponds, then we cannot restrict access to the waters for fishing and fouling, as well as along the shoreline. Thank you.
So I guess I can go walk on the beach if I have a fishing pole.
All right, so, we didn't vote on this motion yet, did we, on the shellfish extension? Okay, we have a motion and a second to extend the deadline to 3 days after town hall reopens. I think that's what how the motion stands. We'll have a roll call vote. Tracy?
Aye.
Norm?
Aye.
Mark?
Aye.
Eric?
Aye.
I vote aye as well. It passes unanimously.
Thank you. The next item, Mr. Chairman, is the memo that I sent relative to the appointment of Mr. Scott Gilmore to the position of Director of Golf. I outlined in the memo the process that we used to arrive to that appointment. So in accordance with the charter, the board has 15 days from the day I send the notice to you to overturn that with a 4/5 vote. So this is more a matter of procedure. If you take no action on it, then I forget the date that I put on it, but very soon he'll reach the 15-day period. April 9th is the 15th day. So.
Does anybody have any questions or comments on that? There's no real need for a vote unless somebody wants to basically undo the appointment, right?
That's correct.
Otherwise, in the absence of any action, it becomes final on the 9th of April.
That's correct.
Okay. Hearing no comments or questions, I'm going to move on to the annual town election.
Yes, Mr. Chairman, there's a memo that the town clerk, Phil Gaudette, had generated relative to rescheduling of the town election. There's some logistic issues he's working out, so I don't have a recommendation for you at this meeting. So at this point, the memo updates you to roughly the date time frame we're looking at. But he hasn't secured all the locations that he needs, although the most significant location is the Cape and Island Association of Realtors building. However, he did get confirmation from Assistant Superintendent Ken Jenks that the school would be available on June 25th because that coincides with the last day of school. That was part of their 5 snow day calendar. But at this point, it's too soon to propose to you any dates beyond that. So
The best we can do right now is to say sometime in late June.
sometime in late June, that's correct. And a lot of this, of course, is predicated on the idea that to some degree, we'll be back to normal operations and shortly after May 4th, because we have a new town meeting deadline, right? But if that, for whatever reason, May 4th guideline changes, then everything gets bumped out. And the legislation recently passed allows communities to have their annual election after July 1. So it's kind of like a wait and see approach for right now.
Okay, next item is grant acceptance for drive-in site. I think Karen's on, isn't she?
I'm not sure if, I think she was maybe or
Karen
someone.
Green.
Yeah, Karen's there, yeah. So this,
Okay.
yeah, go ahead, Karen.
Oh, okay. Well, this one gets filed under good news. That we were recently awarded $956,000
Awesome.
Land water conservation funds. This is federal money that comes through the state. Town staff did a great job putting together the application and working with the drive-in site committee. And this grant will provide a 50% match to the funds that we got through the community preservation program in last year, in 2019. And will really help move things along. So the purpose of this agenda item is just, I think Dan wanted to ask the board to vote to actually accept the grant, and we can go ahead and execute the documents. I think Dan is able to do that. And we'll move forward. Right now, we are looking at the cost proposal that's been put together for the design and engineering component.
Mr. Chairman,
Yes.
I make a motion that we would accept the grant, that we allow Dan to sign on our behalf. And we give great thanks to all involved in garnering support for this and processing the grant application and bringing this money to Yarmouth. The only question I have is, other than the match, are there other strings attached to this grant?
I muted myself, I'm sorry. It's the strings are all consistent with the other strings that come along with community preservation funds and keeping the use as passive recreation on the boardwalk and Riverwalk Parks areas. We actually can't, I say boardwalk, and that's erroneous. We cannot use this pot of money for the boardwalk part. So the funding is limited to the Riverwalk Park portion of the project. And we've broken out the costs accordingly, and we'll be able to take through to that requirement. I don't know, Kathy is on the call as well. Kathy, is there anything I've missed?
No, I think you covered it pretty well.
Okay, so we have Tracy's motion.
I'll second it.
We have a second. Who seconded that?
Norm.
Norm, okay.
And, I'd like to add thanks as well. I mean, I think things are going along very well with the Riverwalk project, and Karen and your staff are here to be congratulated, along with Kelly, for working hard on this and keeping the momentum going. I think that's what the community is really looking for, and I think you're really following through on that. So thanks again.
Thank you.
Yeah, if I could, Mr. Chairman, just weigh in. I know I've been bugging Karen and Kathy about potential grant sources for this, because I think we all are very excited about this project, and I think we all know that it's very, very competitive in terms of grant funding. So I too want to add my thanks to the both of them for their efforts on behalf of the town. It's a great job.
Okay. I add my thanks as well. Do we have a second to Tracy's motion? Norm, you seconded it.
Yep.
Okay. All those in favor, Tracy?
Aye.
Mark?
Aye.
Norm?
Aye.
Eric?
Aye.
I vote aye as well, so that passes unanimously. Thank you, Kathy and Karen.
Next up, Mr. Chairman, is upcoming agenda review. We've put that document in your electronic file. One of the things that I had proposed going forward, starting the week of April 14th, based on all the activity that's going on associated with our present state, is what your interest was on shortened once weekly meetings on Tuesdays. The idea there is that we're doing a fair amount of regular business, and I'll share with you an email that I got from Mr. Grills, who's on the call. So business around us and what we need to do continues to go on, but I'm also mindful that this is a kind of a cumbersome way about doing that. But in the lead up to town meeting, there's a lot of things we'd like to clear the deck on, so.
What's the, to be determined on the 7th?
Well, the 7th right now, because it's Thursday, and we have next week, logistical preparation for, the finance committee meeting and also, another committee meeting that, I would just update you by memo next week, but we would plan on going on the 14th. The, tugboats needs a, public hearing scheduled. And we've advertised for that, so that, they can, get their amendment done for their management agreement that allows them to operate. So they're anticipating at some point this year, they'll be up and running for business, so. And then the week of Patriots Day, April, that's the week of April 20th. That's the normal third week of April. And in the past, we haven't met typically on school vacation weeks, but I'm not sure where anybody can go. But that's up to you if you wanted to meet. Sadly so, right? You know?
Into the marathon.
So I mean, you know, we could skip that one and get onto a weekly schedule starting on the 28th. I'd say it's up to you.
Well, I'd like to hear from the board members on that. Suggestion is to skip the 7th and start weekly on the 14th, possibly omitting April 21 from that weekly schedule.
I'm fine with that, Mr. Chairman. I think that typically coming up into town meeting, we have to find ways, and now with this technology, it's very helpful, and doing it with shorter periods of time, I think is even more advantageous for us. So sometimes we can have some clarity instead of being at 11 o'clock at night, because once we get back into the swing of things, we'll have some lengthy meetings and things to discuss before town meeting. Now that we've put town meeting off, we have a little bit of time, but I think keeping up on it will be important. I'm all in favor of that.
Norm?
Yeah, this is Norm. I tend to agree. I think, you know, with regard to the meeting on the week of Patriots Day, I'd put something in that week, frankly, and just, you know, we can make plans week to week on this in terms of what's going to be on the next agenda or what is really important for us to address. But given the whole fluidity of our situation, I think we probably need to have the availability in our schedule.
Do you want to put something on the 14th?
The 14th is got to happen.
21st, I'm sorry.
Do I
Is that what you're
personally?
saying, Norm?
I'm sorry, what?
You'd like to have a meeting on the 21st?
Well, I think you should keep it on the schedule. I think you should provide for it. Yes.
Hey, Mark, how do you feel about that?
I agree.
Eric?
Sure.
All right. So I think it's the consensus of the board that they want to go weekly starting at the 14th, including the April 21 date.
Okay.
All right, so that's what we'll do. You don't have any appointments, do you, Mark?
Nope.
I don't imagine you've done many interviews lately.
It's tough, but we'll probably have some appointments to make for our next meeting.
Okay. Individual items? Anyone? Eric?
I'm all set. Thank you.
Mark?
No, I'm all set, Mr. Chairman. Thank you.
Tracy?
I just, you know, not to beat a dead horse, but I think it's important that we recognize the severity of what's going on, and that we have had a fatality in our community. And just, you know, hopefully we stick together, look out for our neighbors, and just continue to have safe practices and pray that we get through this in the next couple of weeks. And, you know, my heart goes out to the families of those that are affected. So I think we have to keep them in our thoughts.
Norm?
I do have a couple items. First of all, I'm pleased to hear that Dan, that you and Rich have started the process of looking at the what ifs on the capital and operating budget. You know, I think we need to be well prepared for that at town meeting and be ready to field questions and comments from our taxpayers, because I think that they're probably going to be loaded with that. And you know, there's if we don't have a crystal clear plan, we could stand in danger of losing funding on the school system, as well as many other things, if you know, people are really in a panic. So I think the better prepared we are, the better off we'll be, and I appreciate the fact that you're looking into that now. I'm hopeful that you know, Ed Santio and Rich will be able to come up with some plans that don't involve draining all of our resources that we've accumulated over the last 5, 6 years, 7 years, because you know, naturally those are meant to cover situations of this nature, but at the same time, you know, if we have to tighten our belts in some way, you know, I think we've got to be prepared to do that as well. But, the second item I wanted to bring up was, I know there's been legislation introduced, I don't know where it stands, by the governor to authorize the delays in payment of taxes. And I think that Ed Santio had come up with a number of other options as well, and I hope we can include that on a future agenda. And you know, I don't know I think we need to talk as a board and get the board's sentiment with regard to whether everyone would agree with extending those benefits to our taxpayers. The last item is getting back to the situation with the Board of Health. You know, I think, and this is to Dan, you know, Dan, you know, I hope you've heard the board's sentiments with regard to this, this whole issue. And I'm, you know, these are very difficult times, and there's a lot of balls in the air, but I think that you could serve a real function for the board in getting in between with the Board of Health and getting them to work with us in advance, as opposed to going on their own, so to speak. And I don't know if you may have attempted that already and gotten pushback. You know, I'd certainly be interested in hearing that.
I would say that I spent 20 years in the environmental business and spent a lot of time with doctors and toxicologists evaluating workplace risks and public exposure to various hazardous materials. And through that experience, what I learned is you'll go against the advice of a medical doctor at your own peril. That being said, with the governor's order shutting down DCR facilities and beaches today, effective noontime tomorrow, Falmouth taking a similar step, Dennis talking about it, other states doing it. It seemed at the time, maybe they stepped out a little bit ahead, but I've always been conscientious with the idea that the public has a role to play. They have freedom of movement and expression and whatnot, but government has to be able to, when there's a time of urgent need, to not send a mixed message. And we had a lot of discussions with Hillard and Bruce and myself and their authority to be able to do this, and encourage them to work with the board on this particular topic. And I think with every day that the news passes and the preparation presently going on by the Commonwealth now to prop up 4 additional massive hospitals at the DCU Center, Mass Mutual Center, Joint Base Cape Cod, the state government is gearing up for some terrible days in front of us. And I would hate to be on the other side of a decision that endangered or imperiled anyone's lives. So it's a tough call for sure to the board. And I wished and hoped that they would have engaged the board and had this discussion with you. But I go back to this really is this change. And I talked to Chairman Stone about this. The moment we had positive results here in town, everything on the discussion and dialogue changed. I spoke that, you know, I think it was on the 16th of March, we briefed the staff on some of the recommendations that were being made relative to Council on Aging's and libraries and people. We were getting a kind of a mixed message from the feds, a mixed message from the governor. And I will say the governor's been slow to get out ahead of this thing. And he's trying to balance, I think, too many special interests instead of just coming out and dropping the hammer like I think he probably should. The whole key to this entire thing is to keep people at their houses. And I know that's hard medicine to take, but people, it's been demonstrated that the more movement that they have, the more that this has a problem. And that's why these urban environments in the country are having these problems. And, you know, I'm hoping with the suburban nature of our region, there's enough general spacing amongst citizens, but we also are mixed with a significant endangered population. So Norm, I don't think there's a good answer I can give you. I don't think there's a particular right answer on that. I hear what you're saying. We tried to mitigate collections of people at some of the parks, and we were, you know, getting about that and people gathering there. I've got a couple of Facebook posts and some emails from people supporting what the town's doing. I don't think there's a right answer, Norm, to be honest with you, you know?
Yeah. Okay, well, I just, you know, I think the board, I listened to the Board of Health meeting last evening. There wasn't any public input. There was no discussion. It was just, okay, let's move ahead. You know, so, you know, as opposed to having the kind of a discussion that we had this evening with them, you know, there were no requests for information. There was no information presented to the Board of Health with regard to issues being created as a result of contamination. There was nothing. It was just let's get this to a vote and let's vote on it. And I think that's not the way we're supposed to work in the town environment. You know, we have, I'm not going to go on and on. I've said enough at this point.
Hey, anyone else on public comment?
No.
I'm going to say a couple of things. I agree with Norm. And honestly, this beach issue is more form than substance because, first of all, people are on the beaches. Although I don't think there's a lot of people on the beaches, and I don't think it's because of the Board of Health's order. I think it's because of the weather. It's very cold and it's very windy down there this time of year. I would be all for joining them in that ban if it was a situation where the weather was conducive to public gatherings and people were going to the beaches and violating the 6-foot social distancing rule, then I would say by all means, you're going to have to close the beaches down. It's not a problem. People go there. It's a matter of enforcement. There is no enforcement. The first day I was there, in fact, there was a police cruiser that came down to Smuggler's Beach, it swept the parking lot and left. Nobody got out of the car to see if there were people on the beach, and I don't blame them. I mean, I think for a police officer to approach somebody on the beach would be at risk of his or her health. And if that police officer was a carrier, would be at the risk of the health of the person on the beach. So responsible people are going to pay heed to the warnings that are given to us by the governor and the CDC and all these other sources of information. The people that don't take this seriously, they're a danger, whether it's at a beach or a park or in the neighborhood or whatever, or just walking around. And I think most people are going to be compliant and careful and cooperative, but there's always going to be that element that, thinks they know more than everybody else, and they're the people that are a danger to all of us. But again, I don't think the statute, the legislature put language in there that the Board of Selectmen and the Board of Health should work cooperatively if they didn't mean it. I don't think they put it in there to be ignored unilaterally by the Board of Health. Why would they do that? That's irrational. So I think the legislative intent was, in these crisis type situations, that the two boards get together and that there's a dialogue and that there's a uniform set of guidelines or regulations that are going to come as a result of those meetings. And I mean, I think the law is pretty clear on that. And I'm very disappointed that we have had no input into this critical issue. So that being the case, that's all I have to say on that particular matter. We have a consent agenda tonight.
We do. It's the renewal of the seasonal alcohol and entertainment license in there. In your electronic package, there was the facilities that were named.
I move the consent agenda.
Do we have a second?
Second.
Any further discussion? Mark?
Aye.
Norm?
Aye.
Gracie?
Aye.
Eric?
Aye.
I vote aye as well, so that passes unanimously.
Thank you.
Uh,
On the update items, Mr. Grills has indicated to me, since the state of emergency has been declared, he has generated out of his department 236 various permits and over $26,000 in revenue. And probably the best information I have for you is that the demolition permit for Tasty Buffet is in order and should be acted on next week.
I think
So they've been
Mark
very busy.
Hanke wants to comment.
Yeah, he's there. He put a lot of work into that. I can tell by all the email traffic that went back and forth, and it was probably one of the tougher situations he's been up against as it relates to something that means a lot to the community to get addressed. And he's been like a dog on a bone. So I would like to thank his efforts for that.
Mark, would you like to say anything about your recent experience with permitting?
We enacted the online permitting for 1 and 2 family dwelling permits, as well as commercial permits the week that we were in shutdown. And Tim Sears and I both worked on testing to get it up and running, and it seems to be working fairly well. We have a couple of issues to work out in the near future, but things seem to be moving along pretty good.
Okay, good. Thank you very much for your efforts.
Thank you.
That's all you have for updates? Dan?
I do know that the budget situation is on the minds of the school administrators. I had a conversation, a very lengthy one today, with Superintendent Sanborn, and I'm due to meet with the dentist administrator and the administration of DY sometime next week. We're trying to get that just to get a better understanding of what measures can be done in the event that this is the problem that we think it's going to be, and what that might look like or what that might take. So.
Okay. We have a motion to adjourn.
So moved.
Second.
Second.
Aye.
Okay, roll
Aye.
call. Tracy,
Aye.
Mark,
Aye.
Norm,
Aye.
Eric.
Aye.
I vote aye. We're adjourned. Thank you very much.